A tooth is a hard, calcified structure found in the mouth of most vertebrates, used for biting and chewing food. The anatomy of a tooth consists of several parts, including crown, the visible part of the tooth that sits above the gum line. Root, the part of the tooth that is embedded in the jawbone and is not visible. Enamel, the hard, outermost layer of the tooth that covers the crown. It is the hardest substance in the human body and protects the tooth from damage. Dentin, the layer of the tooth that lies beneath the enamel and makes up the majority of the tooth structure. Pulp, the soft tissue at the center of the tooth that contains nerves, blood vessels, and connective tissue. It is responsible for nourishing the tooth and transmitting sensory information. Cementum, the thin layer of calcified tissue that covers the root of the tooth and helps anchor it to the jawbone. Periodontal ligament, the fibrous tissue that attaches the tooth to the jawbone and allows for slight movement of the tooth. Gingiva, the soft tissue that surrounds the tooth and forms the gums. Understanding the anatomy of a tooth can help in maintaining good dental hygiene and identifying any potential dental issues. A tooth is a hard, calcified structure found in the mouth that is used for biting, chewing, and grinding food. The anatomy of a tooth is complex, consisting of several different layers and structures. The visible part of a tooth is called the crown, and the part that is embedded in the jawbone is called the root. The crown and the root are connected by a narrow neck of the tooth called the cervix. The outermost layer of the tooth is the enamel, which is the hardest substance in the human body. Enamel is composed of tightly packed mineral crystals, and its primary function is to protect the underlying tooth structures from damage caused by chewing and grinding. Beneath the enamel is the dentin, which is a softer and more porous substance than enamel. Dentin is made up of tiny tubules that extend from the inner surface of the dentin to the nerve-rich pulp at the center of the tooth. The pulp is the innermost layer of the tooth, and it contains nerves, blood vessels, and connective tissue. The pulp is responsible for nourishing the tooth and providing sensory information about temperature and pressure changes in the mouth. The root of the tooth is covered by a layer of cementum, which helps to anchor the tooth in the jawbone. The cementum is also slightly softer than enamel and dentin, which allows for some flexibility in the tooth's attachment to the jaw. Finally, the tooth is held in place by the periodontal ligament, which is a thin layer of connective tissue that attaches the tooth to the surrounding bone. The periodontal ligament also helps to absorb the forces of chewing and grinding, which helps to protect the tooth and the surrounding bone from damage. A tooth is a hard, calcified structure found in the mouth of most vertebrates, used for biting and chewing food.